You're welcome to CCMA's Radiology 601. This is lecture 1, and the topic is Introduction to Radiography and Fluoroscopy. I'm Dr. Mrs. Adekoya. I'll be taking you through this lecture. So we're going to be talking about the introduction to radiography and fluoroscopy. We're going to look at some of the uses and setbacks, and then we'll have a look at some images that helps us to make diagnosis. All right, by way of introduction, radiography is just an art and science of using radiation to provide images of the tissues, of the organs, blood vessels, bones in the human body without doing a surgery. Wilhelm Conrad Röntgen in 1985, who we say is the father of radiology, discovered a new type of radiation which we called an unknown. So that's why it was called X-ray, because it was unknown. It was the first to be able to was the first to visualize the inside of the body of his wife's hand without the use of surgery, taking a radiograph of the wife's hand, and for which he won the Nobel Prize in Physics in 1901. And fluoroscopy is just an adaptation of radiography where we use the same X-ray to generate images in real time. So we can look at any structure of the body in real time. However, the major drawbacks in all this radiography of fluoroscopy is that they use a lot of ionizing radiation, which may have stochastic and deterministic effects on the patients over time. And fluoroscopy, the radiation exposure in fluoroscopy is significantly higher than the conventional radiography because of the multiple exposure. The various uses of radiography includes for bone conditions like fractures, dislocation. We want to look at any bone density, whether there's osteoporosis or bone infection like chronic osteomyelitis or arthritis. Lung conditions like pneumonia, like lung collapse, lung cancer, for heart problem like congestive cardiac failure, hypertension. We all make use of this type of radiography. Blood vessels, bowel lobe, dental lesion, detection of foreign body, normal positioning of wires and tubes after surgical procedure. All these are some of the uses of. And then for fluoroscopy, because we make use of luminal structure, visualizing luminal structures in real time. So whether they are for esophageal lesions, where we use barium swallow, for gastric lesions, for barium meal, follow through for barium, for small intestinal lesions, or enema for large bowel. And of course, we also use it outside the GI, where we have hysterosalpingography for uterine and tubal pathologies, cystography for urinary bladder pathology, retrograde urethropy, and micturating cystourethropy for anterior and posterior urethra. And there are so many of them that we use. So these are images to show us the various types of radiographic images that we generate that will help in making diagnosis of any. So in summary, radiography and fluoroscopy, they are important aspects of radiology that uses ionizing radiation to visualize inner organs without surgery. It is fast and readily available. And of course, till I see you the next time, have a wonderful day.